So should doctors be interested and take part in medical history? Yeah, I think absolutely they should. Traditionally, the role of doctors in medical history has been seen as the retired physician, doctor, whatever, who in his or her retirement writes the biography of a famous man or woman. And very often these are rather amateurish products of minimal interest, other than bringing perhaps some people who won't have read about them before to the subject. I think that these amateur historians are rather looked down upon by the professionals, partly because very often what they produce is not of very high quality from the point of view of the professional historian, and partly because over recent years medical historians have become more interested in social history rather than the history of the great man or the great woman in medical history. Yes, I think that's a pity, because I think there is value still to the history of some prominent individual, still worth writing, and there are plenty of prominent individuals who have not had biographies told, so there is still room for that kind of research, provided it's done properly. And I think that people who retire from medicine and want to indulge their interests in history could well be advised to speak to professional historians about how they ought to go about it. So I think there's value in that. I think there's also value in medical history for younger doctors and medical students, and I would introduce them at a very early stage to some medical history in their course, because medical history teaches you a lot of things you won't learn otherwise. There's a lot to learn, for example, in the field of ethics. There's a lot to learn about dealing with uncertainty, how to deal with textual evidence. A lot to learn, I think, from history of medicine that the practice of medicine today could well benefit from. And I think we should be encouraging medical students to take special study modules, for example, or to do a small project in the history of medicine, and to try to encourage doctors as they go through their careers to take interests in the type of history that's relevant to their own subject, because I think you do learn a lot that you wouldn't learn otherwise. And so I think we should be encouraging the introduction of history of medicine at all stages in medical careers. It doesn't have to be a lot, it doesn't have to be dominant, but just an awareness of the historical relevance to whatever subject you're studying can, I think, be very useful.